Talk on the radio, then 8:43 in the morning, the breakfast show on News Talk K-57. Yes, Kevin Kerrigan may say a few things in his new capacity as boss of the press shop over at Guam Regional Medical City. It's always great to have you around, and I'm sure that our listeners might appreciate hearing from you on the radio. Good morning, Kev.
Morning, Ray. Nice to be back.
What you been up to?
Busy. We're trying to open a new hospital. We're making good progress.
I hear. I got a telephone call last week from Dr. Vince Akimoto, and I said, "What you doing?" He says, "You won't believe where I'm at. I'm at the loading dock at GRMC."
Oh, really?
And I said, "What are you doing there?" He says, "I'm watching them put in and unpack the hyperbaric chambers." He was very specific about chambers, and he says, "You need to talk. There's a doctor over there, and you got to get Francie on the radio and talk about this because it's a planet-changing revelation for Guam and how we deal with wound care for folks with things like diabetes and all of that." But before we get into that, and I'll give you an opportunity to introduce our guest here. How you been doing, Francie?
Oh, busy is the understatement word. I mean, I tell you, it's been exciting, Ray, to say the least for me. It's fun. I'm actually having fun doing this stuff.
Nice to be on the ground floor of a new project, huh?
I mean, again, Ray, it's overwhelming because there's so much going on.
Yeah.
And it's almost like picking and choosing which one should you be at. Exactly today. I mean, I said, Kevin goes, "Can you go on?" I said, I really have a 9 o'clock that I'm supposed to be in. There's a conference call every morning.
Good.
Undoubtedly, there's something going on, whether it be in billing, furniture, security, name it. I mean, and it's always say, "Can you just sit in and listen to this and tell us where this is going to go," kind of stuff. And I said, "Sure." So the invitation today is obviously important to us because it's a very new type of service that's going to be given to the people of Guam, but I'll let Dr. Acuna talk about that.
Well, and we will. Dr. Acuna is in the studio. Good morning.
Good morning.
Now, can I call you Auntie Edna as well? Sorry.
Of course. Yes.
Because I know everybody else seems to be doing it, and I just thought that might be an appropriate way to bridge the connection, create the connection between you and our listeners.
Bridge the gap.
Well, it's we have some new friends everywhere we go,
but
right?
She has roots here. I mean, believe it or not, and I'll let her explain why, who her relation is and how she came to Guam.
Acuna. Where's that name? Why is that name familiar? Who do you know that I know besides Francie?
Paul Pineda.
Mm-hmm.
Paul Pineda is a nephew.
Oh.
And then about 5 years ago, we were in the Philippines doing a surgical mission, and we saw him, and he said, "Hey, Auntie Edna, why didn't you come and visit Guam?" So since I haven't seen Guam, we came over and visited the place, and he toured us around and introduced us to the then governor.
Mm-hmm.
And the governor asked me what my specialty was, and I said, "Well, I'm in wound care." And so he says, "Oh, we did that here in Guam." And that was 5 years ago. And so that planted the seed in my head. And so when I went back to Texas, I started talking to my group, and this thing just came up.
No, I fortunately don't know too much about wound care. I don't have diabetes in the house, don't have it myself, and so fortunately it's not one of the things that I have to deal with on a regular basis, although I am told that becomes a real issue for diabetic patients primarily, but you can get yourself in an accident in a car and still have to worry about how we're going to get that wound to heal properly and how to keep the infections at bay. How do hyperbaric chambers do that?
Healing of the wound is done with the hyperbaric chamber as an adjuvant treatment. Clearly, hyperbaric oxygen is not a standalone modality of treatment. It has got to go in tandem with good wound care protocol. So here in Guam, diabetes is such a rampant disease. It's almost in epidemic proportions. And so I see a lot of chronic wounds. I'm talking about chronic wounds that have been open for more than 12 weeks. But the wounds that I see in the clinic are like wounds that have been open for like years. And people end up with amputation or course, the worst thing is death because of the complications of septicemia, severe infection from the diabetes. So there is a big need for a good wound care, and what we're trying to establish here is a comprehensive wound care center that provides not only the basic wound care protocol, but has to be in tandem with advanced modalities of treatments, and one of these, of course, is the hyperbaric chamber. The hyperbaric chamber, the purpose of the chamber is to increase the amount of oxygen that goes into the tissues. The therapeutic effect of hyperbaric oxygen is based on the physiologic and the biochemical effect of hyperoxia. Hyperoxia is high oxygen. Okay, so you're breathing normal oxygen. When you are in the hyperbaric chamber, you get to breathe 100% oxygen under pressure. And so that oxygen goes into your tissues. And if you have that high oxygen in your tissues, it fights the area of the wound where there's no oxygen. So it goes there, and so it produces all its physiologic effects.
Does it also help your immune system to battle the infections and the inflammations?
Correct. Oxygen is really not an innocuous medication. The effect of hyperbaric oxygen is multi-purpose, and one of them, of course, is it produces, it helps to produce like new blood vessels. It's called angiogenesis. So in cases where you have wounds that have no blood supply, if you submit this patient to 100% oxygen under pressure, it will help develop all these new blood vessels. It's just like...
It's a new path. Well,
it's like a new pathway.
Athletes will do that when you're working out, when you're building your muscles or taking on a new regime. The muscles become starved for oxygen and tells the body, bring me some new highways for the blood with oxygen in it.
Very good.
Thank you.
That's a good example.
That's a good analogy.
Right.
Yes.
And so we see the same thing happening with patients. Now, of course, it's not overnight. This will take some time, and so it's important that there is a regime that is followed for the patient so that they can be in there and do this. Will it also help? I mean, I'm familiar with cases where somebody with an infection that had already started the process, and we were concerned about that. We put them in a hyperbaric chamber and then take care of some of the other things that need to happen, stabilizing it and keeping the infection where it is, so that we can work on I don't know, solving the crisis of the moment, if you will.
Correct.
Okay.
So it's not just wounds, really. There's a lot of indications for hyperbaric medications, like diving accidents.
Yes. Well, that's where I think about it first, is and forever and ever it was just the Navy that had a hyperbaric chamber.
Right, they have a multi-chamber.
In my mind, when you start talking about a hyperbaric chamber, I'm thinking of something that is as big as this room, and it is made out of battleship steel, and it's got a little porthole about the size of a compact disc that you can look through and see the patient on the inside as they're watching television or reading or something like that. I saw a picture of the hyperbaric chamber that you guys are bringing in. Not what I was expecting. It looks like something out of a scene of what was that movie, The Fifth Element? You know, where they it's just
it's a mono chamber.
Yeah,
that's what we call it.
So there are two types of hyperbaric chambers. We have the multiplace chamber where you put a lot of people. That's why it's called multiplace. But in that chamber, the patients are not the only ones there. You have somebody who's called a guy who's a tenderer. He takes care of the patients inside the chamber, so he dives as well. What we have in the hospital are two monoplace chambers where a patient will have one chamber for himself, and you don't have the battleship.
The battleship steel.
It's an acrylic. It's an acrylic, so that the technician can watch what's happening to the patient. So I stay outside and watch the patient as well.
You can communicate back and forth with the patient. A little radio equipment in there, right?
Yes. The usual therapy or the protocol for hyperbaric treatments usually for chronic wounds, I'm talking about 5 days a week. You do it like 2 hours a day. and it's continuous 2 hours a day. Sometimes it will last from 30 days to 100 days, depending on the response of the patient.
Now, I like the way you referred to it. I'd not heard that before, but it's the same thing as diving.
Correct.
You're going in, and you're going in under pressure as though you were going underwater.
Correct.
So there's a whole new set of physics that goes along with it. Boyle's law, that kind of
Boyle's
thing.
law, very good.
I was a diver.
You're a diver?
Advanced diver. Yeah, Father Duenas. That's where I got all of that.
You wish.
So you're actually under pressure in this thing, and the oxygen is coming to you under pressure.
Correct.
And so you need to go down and then be brought up slowly, so we don't bend you on the way up.
That's right.
There's all of the science behind it has been all worked out, I think, over the years. So a fairly safe procedure. I think the only thing that I would worry about is a patient that maybe had a touch of claustrophobia. You give them a pill before you stick them in there. Is that?
Yes.
Yes. Okay.
They sedate you.
I imagine that would be a good idea, because some people can handle it, some people can't.
Correct.
Correct. Yep.
But they, we have television, or they can bring their own programs, movies that they can watch while they are inside the chamber. Yeah, if they have the problem of claustrophobia, that's really a minor problem. We just give them some sedation 30 minutes before they come.
Because they don't need to actually do anything while they're in there.
No,
Lay down and
they just lay
breathe the
down
air.
and rest and breathe the air.
Yeah.
But really, hyperbaric oxygen is really not an innocuous medication. It has its complications. It has its problems. If a patient is diving for long periods of time, you can have problems with your lungs. It's called pulmonary toxicity. You can also have central nervous system toxicity in the form of seizures, stuff like that, or optic complications. Some patients develop myopia. But this is a temporary thing. And people with cataracts can have worsening of the cataracts, which again is temporary.
Do you ever get anybody go get a narcosis while they're under that kind of pressure?
No. See,
do you take them that down?
We do not take them down over 2.5 ATA. So because at 2 ATA you can have narcosis easily.
That's the equivalent of about 60 feet down, right?
66 feet.
66 feet.
S2. 1 ATA is 33 feet.
Okay. So you're not going down deep enough to get knocked out?
No.
Okay, that's good.
However, in Ben's disease, you go down 5, 6 ATAs, but that's a different story.
The equipment here will be able to handle that?
Yes.
Okay. All right. So it sounds like all of the T's have been crossed and the I's have been dotted. Now, we're talking about hyperbarics for people that get bent. Obviously, it'd probably be better depending on where they come in to go to Navy Hospital. But if you were nearby,
actually, it's not Naval Hospital. I thought it's down at Naval Station.
Oh, is it? Well, I don't know where the
dive
thing
chamber is down at the.
I couldn't tell you. I've never been in it. Fortunately, knock on wood. So I couldn't tell.
No, I haven't.
The multi-chamber dive, but no,
In addition to that, working with folks for wound care, I noted that you can also use it for other maladies like the compartment syndrome, which it make the connection for me in the head. I was diagnosed with compartment syndrome once. As it turns out, it wasn't. But normally compartment syndrome is something where they in your legs or something like that, and they'll cut a slit from your ankle up to your knee bone and give the fascia some room to breathe. So what's the connection? How do you use the hyperbaric in connection with a compartment syndrome?
Yeah, if you have a compartment syndrome, if it's from trauma or infection, they do what's called fasciotomy. They open it up right away. And so that opens up the wound bed itself that has been compressed. Compression syndrome, you compress the tissues and it becomes ischemic. So there's no oxygen supply. So this is just like the same principle as when I have like necrotizing fasciitis or patients with gas gangrene or other infections where they have this compartmentalized infection. They open it up and then put them in the hyperbaric chamber. What you do now is the effects of hyperbaric oxygen on that would be again to have the angiogenesis, which is formation of other highways, and then two, it enhances the action of the macrophages, which is part of the white blood cells that would be bactericidal. So that also affects the bacterial effects and enhances the effect of the antibacterial.
Hopefully gets you back on your feet.
Hopefully gets you back on your feet and cut the infection down.
Yeah, and your recovery time.
And the spread. Yeah, yes.
Now, are there I want to use the word modalities, but I'm not a doctor, so I'm not going to say so. Use it. But are there things that a hyperbaric chamber are not appropriate for? In terms of wound care, or are there some patients where you say any other time I'd stick in a hyperbaric chamber, but in your case it would be contraindicated?
Yeah, we have a list of diagnoses that we can dive. This is approved. So you have set protocol for each one. So not any Tom, Dick, and Harry cannot just go there and say, I want to dive.
Yeah.
Sometimes some people would just say, want to dive for rejuvenation. You know, Michael Jackson did that. We don't.
So I wasn't going to bring it up, but I'm glad you did.
Well, if they want to pay out of pocket,
he owns his own.
Two of them, right? Yeah, that's right.
There's an MMA superstar, BJ Penn, who has his own.
Oh, I didn't realize that.
He has his own, and he uses it for the injuries that he sustains while he fights. So he uses that, and actually, it was my son Nick that was telling me that there are some gyms in LA that have this now in their actual gyms where they have a hyperbaric
all
chamber.
Of a sudden, it's like an iPhone. Everybody's got one. 9 o'clock in the morning. I got to break away for the CBS News. I know you're going to have to take off, but I'd like to ask Auntie Edna to stick around for a few more minutes. I have a few more questions. We'll open up the phone lines, too, if you've got questions about hyperbarics. At GRMC, I think I need to underscore that point as well. I'll do more of it on the other side of the CBS News.